Thank you, Mr. Chairman. I thought the point you raised, Mr. Chairman, about primary care was particularly important. And we have Mr. Burrell here, and he has gotten into this primary care area, I think, in a very interesting way, particularly bringing providers and patients in together around prevention. And to me, that's really the ballgame. I mean, we understand that most of the healthcare bill in this country goes for chronic disease. I mean, well over half of it. And we spend it picking up the damage of heart and stroke and cancer and diabetes. And you're trying to figure out a way to bring your providers and your patients together and reward the patients. And I think that's particularly good. Since you and I talked, Senator Portman and I got together with the Cleveland Clinic and the Oregon Health Sciences Center and have actually proposed financial rewards for senior citizens under Medicare for the first time who lower their blood pressure and lower their cholesterol and stop smoking, reduce body mass, and the like. And I think in the context of the chairman's question about primary care, tell us a little bit about what you're doing to bring together both your providers, your docs and others, and the patients to start giving prevention and behavioral change, empowering the patients to be part of your new approach.
Well, on the patient side, it starts with awareness of risk, which starts with a health risk appraisal, which we offer for free. Just the discovery of the risks you have, the awareness of the risks you have, has a big effect on behavior. We ask them to share it with their primary care doctor, and we automatically transfer it with that consent to the primary. It has an effect on the primary's thinking sometimes. We start with financial incentives to the member just to participate, and then it moves for financial incentives for outcome. You see that you're overweight, you see that you have hypertension, you see the risks that you have. It's one thing to see it, it's another thing to actually act on it. We want to move to the day where stronger outcomes produce stronger financial rewards to the member. But if you're the only one that knows it as a member and your doctor doesn't, it doesn't do much good. So we give it to our small panels of primaries. It's seen by the panel. We identify the patients at high risk as evidenced by health risk appraisals, and we target interventions together with those primaries for the patients at higher risk. So it's an incentive to the member to participate and be aware and to take action, and it's an incentive on the part of the primary because it's a global population-based incentive model. If they can get a better outcome, they have a financial reward. The member does, and the physician does, and they're dovetailed together. And it's the working together that actually causes, we think, the best result.
Senator Wyden, just at the risk of being a wet blanket in this, and I completely agree with
I like
what you're discussing.
bring up contrary points of view. That's good.
Well, thanks. So we, and I'm not sure you were here when I mentioned this, with Nitish Chowdhury at Harvard and collaborators at that, and we published a piece in the New England Journal of Medicine a couple of months ago where we gave patients who had experienced heart attacks their drugs for free. So they, in fact, didn't have risk factors. They had already experienced the outcome. And despite getting their drugs for free, 0 copays, less than 50% of them were compliant. So there's the ability, for the doctor to do the right thing. They had written for all the right drugs. There's the ability to convey information about risk. But the reality of human behavior is that we need to grapple with some of the complexities associated with this. It's very discouraging, but we've got a long way to go, and we need to understand how to get into the psyche of patients.
There's no question that there are a variety of factors involved here. I think what really swung me to this was the work of Dr. Wyden, who's the prevention officer at the Cleveland Clinic, and the program that they have put together, which essentially is what Senator Portman and I modeled our approach with Medicare, really does seem to be working. And I think they do try to spend the time, certainly, talking with patients, talking with families, incorporating in some of the judgments that you're talking about. But they are very clear, and Toby Cosgrove and others have had a long interest in prevention. They are very clear in their view that these financial rewards, and these are, of course, not enormous sums of money, but the idea of a few hundred, dollars in conjunction with some of these other kinds of approaches has been successful. And since Chairman Baucus has given us a chance to kind of be around the kitchen table to kick these ideas around, hopefully we
That's
can
great.
talk
And it may
about
be the power of social networking and the sense of community, which is something that we're
Right.
pursuing.